Right side carries oxygen for blood. Left side carries what? Oxygen rich. Okay? By the way, are you filming me?
No.
The heart. Okay. Because my picture better not show up on Facebook. You have to clear that with my agent. Okay, so we have external landmarks that you need to identify. Right? The two chambers here, the two superior chambers are the atria. These are the receiving chambers. The two pumping chambers here are the ventricles. Those are the pumping chambers. All right? These are called the great vessels of the heart. All right? Where the great vessels join the heart, they call that the base of the heart. Why? I have no idea. To me, the base ought to be here. That's the apex of the heart. Your heart sits in your chest like this, just a little off to the left side. Okay? Now, externally, you can divide the left ventricle from the right ventricle by this landmark. This is right. This is the interventricular sulcus, because it's a depression. On the inside, it's the interventricular septum. All right, we'll get back to that again. So, on the right side, you have another sulcus. It's called the right coronary sulcus. And what's in there? The right coronary artery. Okay? That separates the right atrium from the right ventricle. This, the interventricular, or in between the two ventricles, depression, sulcus, carries the left coronary artery. If you were to have a blockage in this artery at this point, what would the result be? Yeah, it would be massive heart attack and sudden cardiac arrest death. Why? If you look at it, the anterior descending feeds this portion of the heart wall. Then we have this one going around the back, which is called a circumflex, circling the back. So you have this portion being serviced, the heart wall being serviced. Then you have the posterior coronary artery servicing this portion of the ventricle. So that means that the entire ventricle essentially would lack a blood supply and it would simply die. Okay? That's called a massive MI, massive myocardial infarction, massive heart attack. What are the two things that can block here? What are the two things that block the coronary arteries? Thrombosis, which is a what? That's a clot. And an embolism, which is basically a moving clot or a moving fat. Yeah, it's a chunk of something. And oftentimes it's a cholesterol deposit that gets up in there and clogs it up. Okay. So, let's see, externally. Now, externally on the backside, if you have a whole bunch of arteries feeding the heart muscle, do you have a bunch of capillary beds feeding the heart muscle? Yes or no? Yes. Remember that nothing is going to diffuse through an artery. It only diffuses through the capillaries because the capillaries are what? They're permeable. The arteries are not. Okay? Same thing with the veins. Nothing's going to diffuse into the veins. It's all going to be done at the capillary level. So we have massive capillary beds, thousands upon thousands of capillary beds. Now, if we have oxygen being delivered, we have cellular respiration going on at the mitochondria. What is going to be produced as a byproduct of that in the mitochondria? Oxygen in the presence of glucose breaks down to give us CO2. So if we got CO2, we have a return of blood into where? Into the veins, which go back to the heart. So here are the cardiac veins. This expanded portion of the cardiac vein, rather religious type of music. I need to change that. All right. So we have the coronary sinus. It's an expanded portion. That empties into the right atrium. Okay? And it empties into it right here at that opening. See that opening? It's inside. Just anterior to this opening, which is the inferior vena cava. Okay. Can you turn that down a little bit?
You better stop it so you can send it, because remember, if it's too big.
Okay. So if this is the inferior vena cava, this is the superior vena cava, what ends here?
Systemic circulation.
What begins here? Okay, so now we're going to begin the pulmonary circulation. Inferior vena cava comes in here, superior vena cava here. Goes into the right atrium. Right atrium passes blood through what chamber? Or I should say, what valve? Tricuspid. How do you know that's on the right? Try going right. Okay. The valve itself is anchored by cords of tendon called the chorda tendini. Good job. And then that in turn is anchored by these little finger-like projections called the papillary muscles. Right? So now we're into the ventricle. That's the pumping chamber. Okay? Everybody got it so far? Now, it gets pumped up by the right ventricle through this valve, which sits at the base of what blood vessel? Good job, pulmonary trunk. So the name of that valve is the pulmonary valve. There are two semilunar valves. One is aortic, and the other one is pulmonary. You very, very seldom hear it called a semilunar valve. You call it the aortic valve or the pulmonary valve. Okay, just like mitral and tricuspid. All right, now here's the pulmonary trunk. It gives rise to the left and right pulmonary arteries. And where are those going? And they carry oxygen rich or oxygen poor? Oxygen poor. Okay, so true or false? All arteries carry blood away from the heart.
Away from us.
It's true. Okay. All arteries carry blood away. Arteries begin with A, they carry blood away. All arteries carry oxygen-rich blood. True or false?
False.
That's false. Okay. The exception in the adult heart being the pulmonary arteries. Okay. Into the lungs, into the capillary beds. What goes on in the capillary beds? Do we pick up nutrients in the lungs?
Liver nutrients. Oxygen, CO2. Oh, so you're picking up oxygen.
And you're dropping off carbon dioxide, and you're picking up oxygen. The only other thing that you would pick up is anything that you inhale. Okay? Could be
Nicotine?
Could be Advair for asthma. Could be aminophylline.
Nicotine.
Could be albuterol. Could be nicotine. Right? Could be THC. It could be airplane glue. It could be anything. All right? Okay. That's it. People huff airplane glue and they go, oh, I can't take a vaccination. All right, now. So we get that exchange. What's coming back now? What blood vessels? Pulmonary veins. True or false? All veins carry oxygen for blood. True. False. Okay. The exception being the pulmonary veins, which carry oxygen-rich blood from the heart. From the lungs to the heart. True or false? All veins lead back to the heart. True. Okay? Now, those right and left pulmonary veins are here, and they're going to empty into what chamber? Left atrium, and that is going to mark the end of what circulation? Pulmonary, and the beginning of systemic. Okay? Now, we're into the left atrium. We go through this valve, which is the left what? Could be the left AV valve, atrioventricular, or it could be called the bicuspid, or it could be called the mitral valve. Clinically, what are you most likely to hear? Mitral. You're most likely to hear mitral valve. All right, now, into the left what? Ventricle. And then you can't quite see it here because it's hidden by the left AV valve. All right, see that valve? It's at the base of what blood vessel? You see it? Okay, can you see it?
Yes.
All right, it's at the base of the aorta, so it's called the aortic valve. So we pump oxygen-rich blood into past the aortic valve, into the